Welcome back to D Island Docs. We've just been discussing addiction, and now we're going to focus a little bit more on alcohol addiction specifically.
Alcohol, I mean, a lot of people go out on a weekend, they drink every weekend. Does that make them alcoholics?
If you do actually fit the criteria that we discussed in the first part about the DSM-4, then yes, then you are in fact an alcohol addict.
Okay, so there are a few questions that we ask usually as a medical practitioner to try to find out if you fall into that category of being, someone who abuses alcohol. So the first question is, have you ever tried to cut down on drinking? If the answer to that question is yes, then there is a possibility that you are abusing alcohol. Second question is, have you ever been annoyed while intoxicated, or have you annoyed those around you and made them angry? That's the other question. If the answer is yes, then that's another strike for alcoholic. The other thing is, have you ever been guilty? So you wake up in the morning and you think to yourself, oh Lord, I drank too much last night. Then that's another question. That's another strike pointing in the direction of being an alcoholic. And the final question is, have you ever had a drink as an eye opener? So you get up in the morning and then you have a drink. So when you add it up, if you have 2 or more of those 4 questions of being positive, then you probably have an alcohol dependence problem.
Yeah, and why is it so important that, we know about alcohol and alcohol dependence is that, you need to know when you're intoxicated, what in fact are you doing to your body? So some of the symptoms and the signs that you see for alcohol intoxication, I'm so sure you've seen it outside of a bar, outside of a club. You see that delayed slurred speech, like I have right now, but I'm not trying. Slurred speech, then you have, delayed reflexes.
Yeah, you're uncoordinated, you're moving very slow.
It could even go as far as like loss of consciousness or blacking out.
Or even in just impaired judgment.
Yes, definitely. And then if you are having those symptoms, it can affect your organs of your body, like your liver. It can cause cirrhosis. It can affect your brain. It can also affect your heart. It can affect your nervous system. So these are the things that alcohol does. So sometimes you have withdrawal symptoms like tremors, or you might have some tachycardia, which is your heart palpitating faster than normal, or you may even have seizures or hallucinations. These are some of the withdrawal symptoms. And if you have been using alcohol for a long period of time and you try to quit cold turkey, you may experience something that we call DTs, or delirious tremors, and that can lead to something as severe as death. So we recommend that if you are trying to quit and you've been taking in alcohol for a long period of time, that you do it in a medical facility so that we can facilitate for all those, those withdrawal symptoms.
Yeah,
that you
I mean,
might
this message is for those out there who drink a lot of alcohol. You know yourself, you're out there, you're abusing alcohol. And you have been convinced that it's time to stop. We have to advocate that you do not stop cold turkey, because if you stop cold turkey, you are going to experience withdrawal symptoms, and it can go up to coma and death. So if you're going to stop, you need to check yourself into a healthcare facility, into a rehab, and then where there are healthcare providers who can assist and give you support when you start going through your withdrawal period.
And for those who are, want just assistance, there's always AA, Alcohol Anonymous, where you can do group therapy and get that support from people around you to help you with quitting. And if you have in fact quit, keeping on the same track.
And the other addiction that we would like to talk about is cocaine abuse.
Cocaine addiction affects so many people in so many different ways, and the symptoms of it can be from something minor to something more severe, right, Dr. Gordon?
Yeah, I mean, when you abuse cocaine, when you're high on the drug, there's so many symptoms that you experience straight away. Things like increased heart rate, increased blood pressure, sweating,
dilated pupils,
agitative excitedness and agitation,
hallucinations. You may even have like seizures sometimes.
Yeah, so cocaine is actually one of those drugs that really, really affects your body. It causes dilation of pupil, causes flushing. It can cause devastating effects to all of your organs.
And I mean, how many of us have heard about those movie stars that, die from overdose or cocaine overdoses, and, that can lead to sudden death.
After you have abused cocaine, you have the problems of dealing while you're on the high, but also when you start going through the withdrawal symptoms, when you don't have access to the drug, it can also cause damage to your body.
Definitely. The same amount of damage it's causing while it's you're on your high, sometimes even more when you're in your withdrawal symptoms. So you might be experiencing like anxiety, insomnia, you can't sleep at all, you're having depression, you're agitated, you even feel like formication, which is like little insects and stuff crawling on your arms. So the spectrum of symptoms that you have when you're trying to quit is very, very serious.
Yeah, exactly. I mean, the components of cocaine causes the increased contractility of your heart. It causes your heart to beat so much faster with so much more force. It causes your blood pressure to shoot up through the roof, so it can cause you to have a heart attack or even a stroke.
Yeah, not to mention that cocaine can also put you at risk for things like infective endocarditis. I mean, you think about it, you're using dirty needles or you're using needles that are not sterile, then that can lead you to being at risk for having infective endocarditis, even HIV, even hepatitis, which are very serious diseases to get.
I mean, infective endocarditis is what happens is that you inject in bacteria and bugs, and those attach to the vessels of the heart, to the valves of the heart is what I want to say, and cause extensive destruction.
Yes, and also another form of addiction that people are often dealing with is smoking addiction.
Smoking one cigarette paralyzes the cilia in your trachea. What does that mean exactly? The cilia is the respiratory escalator. What it does, it traps dust and particles and wafts it up towards your mouth so that you can swallow it. Smoking paralyzes that whole mechanism, which causes all that dust and all that particles that's in the air that you breathe in to go down and causes infections in your lungs.
Yeah, so that's why most smokers suffer from diseases like COPD, emphysema. They can even have other diseases like lung cancer or even, throat cancer, gum disease, peripheral artery disease, heart attacks, strokes. It's actually been proven that smoking is related to almost every form of cancer out there. And why people decide to smoke is probably because of nicotine, and they can't stop because nicotine has such strong addictive properties.
Yeah, I mean, because when you start smoking and then you try to stop, you go through the withdrawal symptoms, and some of the withdrawal symptoms include agitation, anxiety, sweating, and depression. Now, I know some women smoke, and then when they try to stop smoking, they experience some weight gain. So weight gain actually happens whenever you try to stop smoking. But I want to urge you women out there to, to try to cut down, try to stop smoking. I mean, if you put on a little bit of weight, then there are other means and ways to get rid of the weight.
It's better to be alive than to be, slim and unhealthy. And there are ways out there for you to help you quit. There's always the nicotine patches. There are gums that you can try. There's even behavioral therapy. Some people try hypnosis. I mean, you can even try medications like bupropion in order to help you with your quitting process.
Yeah, I mean, if you go and see a healthcare provider, if you see a physician, there is medications to help you quit smoking. We're going to take a break now, but when we come back, we will speak to one guest who's been battling nicotine addiction, so stay tuned.